We know that health and social care is under tremendous pressure at the moment, so we have to do things differently. And so coming together as a vanguard has sort of allowed us to fast forward those changes to make improvements.
The whole side of caring for patients has got a lot more complicated, both medically and socially, with lots of different teams going in and not really all working together.
I got very muddled at first when all the various carers and voluntary workers all sort of turned up. I came out of the hospital and I felt very, very low indeed. And if it hadn't been for Tasmin, I wouldn't have picked up like this or anything.
We want to keep people well in their own home for as long as they possibly can be. So if we can come together and identify the gaps in the care, we can actually start anticipating the things that might go wrong that would otherwise mean if they went into crisis, they would go into hospital, and that's the worst place for some of these people. Encompass is a partnership of 13 GP medical practices across Ash, Canterbury, Faversham, Sandwich and Whitstable, and they've come together to form something called a Multispecialty Community Provider, or an MCP. Now what they'd like to do is work together to improve the services for their local population. A CHOC is a community hub operating centre, and that's where we bring all that information together. So some of it is a physical thing where you bring teams together, and some of it is the use of the IT, the information that we need to share between organisations.
So the integrated care management is where we as a group of professionals all sit and meet and discuss our complex patients.
We're learning about what the other services can provide. My role's always been to contact these other services, but actually to work so closely with them now as well. They give you, they'll say things, oh, this can be done for that person that you never knew about.
Being part of this meeting allows you to say, I can do this part, but I need some support from another element of that. That could be via the voluntary sector, going in and supporting, looking at loneliness of patients, and you might have recognised it, but you might have been able to be in a position to provide the support that needed.
We have better access to our health colleagues, and they have faces to put to names, and social services isn't some kind of shapeless entity in the background. It becomes a real thing.
A lot of the existing services are integrated together, and we're in there right from the start. So we are an additional prescription route, if you like, for health workers to help to address those non-medical needs. We do a lot of joint working with care agencies in the community to promote good practice of mobility, transfers, manual handling, looking at maybe bespoke equipment that might not be the norm.
Everybody has come to the house, and willingly, and I've been very, very grateful for that.
It's important that the patient is at the centre of the care plan because it is about the patient. A patient who is unhappy with what you put in or provide won't use it, and the things that seem important to me actually may not be the most important thing to the patient. I would never have thought for Valerie that a trolley with a carrying area on it was going to transform her life.
When I am on my own, I do use it. I push things around. Files if I'm doing something, or books if I want to check books.
We see this as a model for dealing with the whole population and feel really positive that the only way forward to improve care for people in our local communities is to have a truly integrated services that are working to use resources more wisely, but actually increase the quality of care for that growing population and the needs that are out there.